Well, greetings, everybody. It's a nice Sunday evening. And as you can all see, I am not recording from the dungeon location. It's a much nicer atmosphere out here, okay? So I've been very busy lately with USA Wrestling. My son is involved in USA Wrestling, and his goal is to make it to the national tournament in Fargo, and it requires a great deal of time and commitment on his part, which in turn requires a great deal of time and commitment on my part. Seems as if I always have to be somewhere to do something. In addition to that, an individual on my wife's side of the family recently suffered a medical event, and my wife's very worried about the person and under a little bit of stress, and we're going to be visiting some family soon. So just like all of you, my life is full of adventures and stress and so on and so forth. But moving forward here, what I want to talk about today was this idea of seeing emergencies in the neurology clinic and ASAP appointments, because this can be very frustrating on both sides, okay? There's not a day that goes by where somebody does not request that they be seen immediately in our clinic, and we can't always honor these requests. And please allow me to clarify a few things and explain why this is the case. First and foremost, as you probably know, there's not a lot of neurologists to go around. Every one of us is very busy, and we all are booked far in advance. Let's be realistic. If you call a neurologist office tomorrow, you're going to wait 2 to 8 months to be seen. We don't live a glorious lifestyle. Neurology is only fascinating to neurologists. Nobody wants to do our job. Nobody wants to be us. Just to make an example of this, think about some very popular medical dramas that have been on television. ER, Grey's Anatomy, House, even Scrubs, we'll throw that in there. What makes these shows interesting? What makes these shows attractive to an audience? Well, these shows, they focus on the good stuff, the juicy stuff, right? Blood and guts and life-saving surgeries and traumas and restarting hearts and those types of things, okay? There actually was, get this, there actually was a medical drama about a neurologist once. The TV show is called Black Box. It was on the ABC network. And I liked the show. I tuned in every week. I loved it. It was canceled after one season. So that just goes to show you that you can't really make a medical drama about a neurologist. It's been done, it's been tried, and it failed, okay? People don't want to be us. People don't want to do what we do, okay? So there's not a lot of us around. And therefore, we're all booked. We're all very busy people. And I know that's frustrating to each and every one of you to hear. It could take a while to be seen in the clinic, but please allow me to give you this advice. If you're given an appointment date and time, please take it. Don't get frustrated. Don't get mad. Don't get angry. Don't get mouthy with the person giving you the appointment. Just take what is given to you. And the reason why I'm giving you that advice is the following. Let's just create a very real scenario that does happen in my clinic quite often. Somebody will call in and my staff might say, it takes 2 months to be seen, right? And the person is on the other end of the line. They're angry. They're upset, and they start getting a little bit lippy with my staff, and my staff tries to explain to them, sorry, that's the earliest we have is 2 months from now. So they hang up the phone in frustration, and they do not take the appointment date and time, right? So what does that person do? They call a different neurologist office, and they find out that neurologist office is booked out 3 months. And they grumble and they call a third neurologist and find out that person's booked out 6 months. Then they call a fourth neurologist and find out that person's booked out 8 months. So then they sit and they think, well, maybe I should call back that first guy, right? Because they were shorter than everybody else, okay? No, I'm not happy about having to wait 2 months, but at least it's not 8 months. So by the time you call back to clinic, guess what? That date and time that we offered you will be gone. It will already be given to another person. Because yes, we are that busy, okay? So please take the appointment dates and times that are provided to you. Don't get upset, don't get angry, don't try to go see somebody else and get, we'll get to that in a moment, okay? Now, the other thing you have to keep in mind here is this, okay? We don't see emergencies in the clinic. Honest to God, if you think that you're at home having a stroke, the last place you should be is in my clinic. Think of it this way. If you're clutching your chest and you have chest pain and you think you're having a heart attack, you're not going to call up a cardiologist and say, hey, can I come in and be seen today? Of course not. Because even if that person is the smartest cardiologist on the face of the planet, they can't help you in their clinic. You have to be in the hospital. It's the same thing for us. Okay, first of all, I'm not the smartest neurologist in the world. I'll admit that to all of you. But on the rare chance that I was, it doesn't matter. Okay, if you have an honest to God emergency, if you're having a seizure right now, and you've had 10 of them today, if you're having a stroke right now, you're literally on the phone with your face drooping and slurring your words, I can't help you in my clinic. It is best for you to be in the hospital. Go to the emergency room, and myself or the on-call neurologist will gladly take care of your problem for you in the hospital. That's where you need to be for an emergency, okay? Now, as far as ASAP things and so on and so forth, I'll vent to you all a little bit because here's what I think would help you out. Maybe I can't see you right away, but that doesn't mean that I can't help you from a distance. If your primary care doctor has an issue, we could certainly have a conference, me and that person could have a discussion. I could say, look, I can't see the patient right here, right now today, but here's some things you could try in the meantime. Or if we do agree that you should go to the emergency room, we can expedite that, okay? Because I know what that's like for all of you, right? If you say, fine, I'll go to the emergency room, then the ER doctor starts rolling their eyes like, oh, no, here comes Sally again. She's been to the ER 3 times this week for her headache. Here she comes again. What are we going to do? What needs to happen is an intervention from myself or your primary care physician. Somebody needs to pick up a phone and talk to the ER and say, look, I know this patient's coming over there again for the 4th time this week for her migraine, but could you at least do an MRI this time? Could you admit the patient to the hospital? Okay, because if you admit them to the hospital, then I have to see them on rounds the next day. We can come up with a much better solution to their problem. I mean, these are the things that we need to work out. So I'll admit to you, it's always frustrating that when you or your doctor becomes demanding, my staff will say, hey, have your doctor call us. Have your doctor call my doctor. They'll work it out. They'll figure something out. Here's a secret for you. 9 times out of 10, they never do. And by the way, when you say that Dr. So-and-so said something, don't embellish the truth. I'll find out you're lying eventually, vice versa. Okay, we eventually will touch base one way or another. So that's my advice to you all today, okay, just about emergency appointments and ASAP appointments. And one more thing, okay, this is just another thought for you. When Tom Brady won the Super Bowl again this year, for the next 24 hours, I heard he's the greatest of all time. He's the GOAT. He won all these Super Bowls with the Patriots, and then he won one with the Buccaneers. He's the greatest of all time. Let me ask you a question. Do you really think Tom Brady would have won all those Super Bowls if he was the starting quarterback for the Cleveland Browns? I know, I'm sorry I'm trashing the Browns, but really, what I want you to stop and think about is this. Same person, same skills, different team. Or think about this for a moment. If you own an NFL team, let's say you own a team, and let's say that for the past 5 seasons, your team has made it to the playoffs, but did not make it to the Super Bowl. They consistently made it to the playoffs all 5 years, but there's just that little extra factor, they did not have that got them into the Super Bowl. Now you're frustrated, right? You have these really good players. They're some of the best around. They'll get you to the playoffs, but they just can't get you to the Super Bowl. So when the sixth season starts, are you going to go out on the field the first day of practice and say, you know what, all you guys, you've disappointed me for 5 years. I'm going to bench all you first string guys. I'm going to put the second string guys out or the third string guys out. We'll see if they get me to the Super Bowl. Stop and think about that. That's not a good idea. And listen, I have to be very careful how I present this to you because it's going to sound like I'm trashing myself a little bit, okay? In reality, your primary care physician, whoever that person might be, in their head, they have a list of first stringers, the people they consider to be first string specialists, okay? Somewhere in their head, they have a neurologist in mind that they want you to see, okay? And you know what? It might not be me. And that's okay. I'm not offended by that. But again, I have to be very careful on how I approach this. If your physician, your PCP, or even yourself thinks, okay, I've already tried 3, 4 other neurologists, I guess this fifth guy is good enough. Stop and think about that. I was not the first person that came to mind when they wanted to send you to a neurologist. You're going to go down a list of neurologists and just accept an appointment with me because I might be the first one to see you? That may not be the best for your care. If your doctor really wanted you to see somebody, then you probably need to see that person. And if that person can't see you in a timely manner, then it is up to your doctor to call that neurologist for help, okay? And yes, there are PCPs out there that I do have a good rapport with that will call me and we will have discussions about the patients and try to help each other out. And there's some that don't, okay? But that's the point, okay? They need to do their job just like I need to do my job. At the end of the day, our goal is to help you, okay? Unfortunately, I can't be at all places at one time. I wish I could. Honestly, I mean this, okay? I wish I had the capability to address all of your problems immediately and take care of all of you in a day. Unfortunately, I'm a neurologist for a living, and well, you know, our profession doesn't work that way. But again, it doesn't mean that we're incapable of helping you or working some type of arrangement out with your doctor. Please call them, have them call us. We'll work something out, okay? And don't get frustrated because, again, sometimes in that regard, you do need to be an advocate for yourself. Sometimes you do need to push for yourself. And might I just say, do it in an appropriate manner. If you call your PCP up and start yelling and swearing at them, they're probably going to hang up the phone and discharge you from the practice. If you call my office up and start yelling and swearing at us, we're going to discharge you from the practice. Okay, any physician will. So please don't do things like that. You do have to advocate for yourself, but be appropriate, and we will help you. Okay. Anyways, if you do have any other questions, otherwise, certainly please feel free to ask. And have a great day. Okay, I hope this weather holds up. I love it. And I hope you all have a great summer. Thanks.